Hello friends, I am Homeopath R.S. Sani. I keep on making videos from time to time on different remedies or different cases. Today, I'll speak on some snapshot cases. Friends, what happens many a times that the patient gives you peculiar indications while narrating his or her case. From the history of the case, we can pick up those peculiarities if we are focused and we are listening to the story of the patient attentively. We have to keep our ears and eyes open and be unprejudiced at the same time. If we as physicians have our minds totally empty, vacant, then only we can be unprejudiced listeners and unprejudiced observers, which is a chief requirement while treating a case in a homeopathy clinic by a homeopath. I shall today share some snapshot cases from my practice which turned out to be beautiful cures after the appropriate remedy was administered. Case number 1 is the case of a female child of 3 years age. She had severe adenoids growth. She was unable to sleep. She used to keep her mouth open during sleep and even during day also. This had caused her dryness of her mouth and dryness all over, and the child was feeling very uncomfortable. So were the parents, who couldn't see the agony and the suffering of the child. The ENT specialist had scheduled a surgery of the adenoids to relieve the discomfort of the child. In the meantime, the parents decided to come to me for the treatment of the child in this condition. In case of children, almost in all the cases, when the parents come for treatment of the child, I ask the history of the pregnancy from the mother. How did she feel mentally and emotionally in those 9 months when she was carrying the child in the womb? This information leads us to the selection of the appropriate remedy in most of the cases, because each person has different experiences. Some have traumas during pregnancy, some have any other problems which are connected with the IPR, the other members of the family staying under the same roof, and some mothers have problems at work if they are feeling well at family front, but the work culture and the workplace gives them some troubles on their mental emotional plane. In this case, the mother informed that during her pregnancy, she suffered a lot of insults, a lot of rude behavior from the side of the father-in-law. The father-in-law was very strict, very dominating, and very rude in his behavior towards me. And I had to stay quiet in those days, and I had just tolerated his bad behavior all along. From here, after listening to her story, 2 rubrics were coming in the forefront The first which I took was the honor wounded aggravate. She felt that she was insulted, her honor was wounded, and then the domination by the father-in-law, the ailments from domination. Then I asked the mother, what's the hobby of this child? What does she do? She said she's a very artistic child. She draws and paints beautifully. Her paintings, we can say that those are so exquisitely done that if she colors, none of the color falls beyond the borderline of the structure, borderline of that particular drawing which she draws and colors. On this, I gave one paper and pen to the child and I asked her to draw something, whatever comes in her mind. Doodling also tells us about the inner mental state of the child. You know what she did? She drew a very beautiful picture of a sparrow. From here, the third rubric was in the sight, which was artistic aptitude. These three rubrics brought forth the remedy carcinosinum. Carcinosinum children are very sensitive, they are very well behaved, they are very artistic, and carcinosinums, when they become adults and young and even beyond their lives, they turn out to be very responsible and very caretaking of others, and they turn out to be professionals of high grade, high degree. In adult age, many carcinosinum patients also suffer with domination, but in certain cases that domination is a positive one, which means that the adult child feels, the adult person feels that one of the parents, especially the father, has chosen a career for themselves. The father has fixed a target for them to achieve, and in order to earn their approval and their acknowledgement, the person tries to get to that target, tries to achieve that target, and in that journey they have to be very responsible and very well mannered and very well behaved. So sometimes a state is planted onto the mind which leads us to the selection of proper remedy. And in this case, the domination planted an effect on the mental emotional plane of the mother during pregnancy, and the effect of that domination was fed to the unborn child, and the child was born with one or the other kind of physical ailment, and this ailment, which showed blockage in the nose, blockage in the respiratory tract, and blockage is nothing but stifling experience. This experience on the physical plane, with the suffering of the child having the blocked nose, it replicates with the experience of the mother during her pregnancy. She also felt very choked. She also felt in that particular situation as if she is suffocated. So, carcinosinum 200 single dose was given to the child, and after 30 minutes it was observed that the child was breathing easily. And next day they had the appointment with the ENT specialist. On examination, the specialist said the adenoids have regressed and there is no need of any surgery. So this brought about a great happiness and satisfaction to the parents, an easiness and comfort to the child, and at the same time, it brought happiness to me and the practice of homeopathy. Homeopathy is supreme. We are all trying to do our best in order to help the patients through selection of appropriately indicated remedies. Now, the second snapshot case I will relate, it also belongs to a girl, 12 years of age. The remedy was also selected depending upon the atmosphere being there at the family front. This girl was staying at the place of her paternal grandfather. The history of the childhood was that the parents had fallen apart. They had divorced when the child was 3 years old. In order that the child was properly raised, the mom decided to send her to her parents' house. There she lived and she had her schooling at that place in the care of the grandparents. The father had moved out of the family and had settled abroad. The child had never seen the father. She didn't have any memories of the father because she was too young when the parents separated. One fine morning, the patient tells us that when she was at her grandparents' house, someone came in the home. He rang a bell and she opened the door. He asked that, "I want to meet Mr. So-and-so person." She said, "Okay, please take seat." She heard her grandparents saying that he has come here also. And there was some other person from the village who incidentally came to their house, and he said to the grandparents that you shouldn't have allowed him to come here. He had left his family, and if he had been together with his children, this poor girl need not be here with you in your care. When she listened to these words, she was dumbfounded. She started having migraines. She started having vomitings with the headaches after that. So from this story, what we get, that this girl child, never knew that her biological father was there around, ever. When she came to know that this is the person who has come in their house today, is her biological father, she had this as a bad news to her. And this was a depressing, sad and bad news for her. The first rubric which I took was ailments from sad, depressing or bad news. And second, she had that grief of losing her father all along these years, but now she has come to know about the truth. So the second rubric taken was grief sorrow, general losing objects after. The two rubrics bring forth remedy, which is Ignatia. Ignatia 200 was given to her, and after taking the remedy, she reported that she doesn't have any headaches. There are no vomitings at all, and that she doesn't nurture any grief also. Friends, the third case is the case of a stepfather who is 45 years old. He is having apathy and lot of blisters in his mouth. Whole of his tongue is full, and the aphthous condition is making him very difficult to eat and drink. When asked what's the reason, which he thinks that he has landed in this condition, he says, we have a stepdaughter who is 25 years old. She comes to our house once in a week. Whenever she comes, she has a very bad and insulting behavior with us. She uses the F word. She doesn't respect us at all, neither me nor her biological mother. She's so much abusive that she throws any stuff onto us in order to harm us. She will punch the walls, and she is so destructive that she can even beat us. And 2 days before, what happened was that she said, get out of the house. Don't come here. Don't come near my mom. She is my mom. And the patient said that she insulted me to the extent that I couldn't do anything in that situation. I literally started trembling. And after that, I observed that there were blisters in my mouth. And it was very hard for me to eat and drink. I am feeling so low also on my energy level after that incident. So here, after listening to his story, two rubrics came in the forefront. First was the honor wounded. He felt that he was insulted, which was an unjust insult. He didn't deserve it. Honor wounded aggravates. And the second was indignation, mortification. And the two rubrics led me to the selection of Staphylococcus aureus. Staphylococcus aureus 200 was given in a single dose, and the very next day, the patient informed that there are no more blisters, the mouth and tongue is no more aphthous at all, and he is able to eat and drink. He also informed that I feel very light, both emotionally and psychologically. So friends, through these cases, what I want to assert is that while taking up a case or listening to the story or history of the patient, we need to focus entirely on the words the person is using. This will lead us to the selection of appropriate rubrics, thereby coming to the selection of the proper remedy. Thank you very much for listening to me today. In future, I'll be coming up with more snapshot cases so as to learn to select the appropriate remedy through listening to the cases with a focused mind. Thank you very much. Thanks a lot.